healthier through any of a host of ways, that's the only thing that ultimately, at the end of the day, is going to change their behavior, change their lifestyle, decrease your cost structure down the road. So fantastic book if any of you are interested. Obviously, with all these, there are legal caveats in every way, shape, or form. It depends dramatically whether your wellness program or whatever that you would do is within the structure of your group health plan, or whether it's run through your on-site occupational health clinic or through your employer site plan, something like that. Very different rules that you would have to follow, that your attorneys, your HR benefits managers, they know these, they keep on top of these, and they can make sure that you're going to be legally compliant in any new innovative idea you have to incent your workers to do the right thing. I'll leave you with just a couple ideas. Future trends, more and more this idea of behavioral economics, or the fact that we don't always act in a rational, self-interested way. Many times we make irrational decisions, and the more we get our hands around our neuropsychology and hold the right carrots at the right time for the right people, they're going to be dramatically more effective. Wait and see what some of the resolution of the legal challenges to wellness plan, incentive plans, and particularly the penalties are going to be. That may change your behavior through time. We don't yet know what the final regulations are going to be for the healthcare reform plan, wellness initiatives. They're all over the map right now in terms of projections. The more that you are willing to invest in ergonomics, job analysis, some of the other things that we talked about today, the less workers' comp claims, the less long and short-term disability claims, the less ADA problems you're going to have down the road. And as long as we stay in an employer-based healthcare system, it really is your obligation to kind of understand this burgeoning science, understand why your workers are costing you so much more and perhaps producing less than you expect them to, and some of the things that you can do to try to get your arms around that. If you have a large number of employees in one particular area and you're in one plan with a network of providers, I would urge you to have somebody at your company go out and meet with the 3 or 4 or 5 doctors who see the largest percentage of your workers. Make sure they understand your health plan. Help them cross-refer back when necessary to your EAP plan, to the nutritionist on site, to the wellness initiatives you have on site. Doctors are out there in their clinic and they have absolutely no idea what goes on at your company. They don't know what your worker does. They don't write reasonable work restrictions because they don't know what your worker does. And the more they feel like you're part of the community and they know what you do, the better stewards of your healthcare dollars they're going to be, and the better they're going to advise your workers as to what they can and can't do with the resources that you're already paying for your employees to have. Employers and insurers out there, with one caveat, I didn't in any way mean to say that obesity is bad, we need to do something terrible and drastic. It is bad in the sense of what it's doing to our society, but it's like anything else. We didn't get to the point where we said, we don't want our health insurer to pay for lung cancer treatment because those smokers did it to themselves. So we probably shouldn't have a discriminatory way of looking at obesity by saying we shouldn't cover gastric bypass because that was their fault that they got fat, especially now that we have great research showing that you actually can have a return on the investment and cure diabetes. So that's changing the science as well. So, it's one more of many health risk factors that we've got to be cognizant of and have some plan of action to help our employees negotiate. And if there are any political leaders left in the room, I would just urge them to consider the idea that every policy that comes down in a legislative context changes our behavior. When our tax goes up 0.1%, some of us make changes in order to address that. So all of the changes that they're making in whether it be the public health plan, whether it be at the insurance commissioner level, whether it be regulations and restrictions on what you can do in your industry, it's going to change not just the dollars and cents in the budget, but it's going to change the behavior of you and your employees. So the more thought they can give to those unintended or unthought about consequences down the road, the better we can all be in sync and hopefully make better choices as we go along. So sorry I went over a little bit, Jim, but thank you so much for